Hi friends, today's our topic is disorders of uterine action or uterine dysfunction. In this video, I will explain about different types of uterine dysfunctions and its management. So let's move on to our today's topic, disorders of uterine action. Disorders of uterine action refers to abnormalities in the frequency, intensity, duration and coordination of uterine contraction, which can affect progress of labor. They are the common causes of dystocia. So next we will see the different types of uterine dysfunction and its management. First of all, I will explain about hypotonic uterine dysfunction. In this condition, uterine contractions are too weak, low amplitude and low frequency, which is seen usually in multiparous women or uterine overdistension cases such as twin pregnancy and polyhydramnias. The main features include weak, infrequent contraction, slow cervical dilatation and prolonged labor. The main management include rule out obstructed labor, amniotomy, oxytocin infusion if no contraindicated. Then we have to monitor the fetal and maternal status. Among the types of uterine dysfunction, next one will be hypertonic uterine dysfunction. In this condition, uterine contractions are frequent and painful, but uncoordinated and ineffective. This condition will be usually occur in primigravida. The main features include painful contraction with a minimal cervical change, uterus remain tense between contraction, increased uterine tone and possible fetal distress. The main managements are sedation or analgesia, rest and hydration, avoid oxytocin. If the condition still persists or worsening, we can go for cesarean section. The third type is incoordinate uterine action. In this condition, contractions are present but not coordinated, which lead to poor labor progress. This type of uterine dysfunction will be having a subtypes. These are asymmetrical contractions, spastic lower segment, formation of constriction ring and colicky uterus. Here the main management include correction of maternal dehydration or electrolyte imbalance. The second one is sometimes require cesarean delivery if not correctable. So these are the management of incoordinate uterine action. The fourth type of uterine dysfunction will be tonic uterine contraction or tetanic contraction. In this condition, a sustained prolonged contraction of the uterus without relaxation. The main cause will be overdose of oxytocin and placental abruption. The main dangers include fetal hypoxia and uterine rupture. The managements are immediate cessation of oxytocin, administer tocolytics such as terbutaline and emergency delivery if necessary. The last type of uterine dysfunction is uterine inertia. This is the general term for inadequate uterine contraction, which are often synonymous with hypotonic dysfunction, which include primary and secondary uterine inertia. In case of primary, there will be poor contraction from onset of labor, whereas in case of secondary, initially normal contraction that later become weak. The management will be similar to the hypotonic dysfunction. Here we reach the diagnosis aspect of uterine dysfunction, which include clinical observation of contraction pattern. Second one will be vaginal examination. In that we will see the cervical dilatation and fetal descent. The third one will be intrauterine pressure catheter insertion if it is indicated. Last one will be cardiotocography in order to monitor the fetal well-being. So these are the diagnostic measures which we are using in case of uterine dysfunction. Here we reach the last part of our today's topic, that is complications of uterine dysfunction. These are prolonged labor, maternal exhaustion, increased risk of infection, fetal distress and increased cesarean delivery rate. So here we can wind up our today's topic. So uterine dysfunction is a vast topic, but in this video I explained it in a simple and concise manner. I hope all of you understood about today's topic. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.